What does an audiogram actually show about my hearing? Imagine a graph that can tell you a lot about how well you hear and what kind of hearing challenges you might face. That graph is called an audiogram, and it is a key tool used by audiologists to understand your hearing health. An audiogram shows your hearing ability across different pitches and loudness levels, giving a clear picture of your hearing sensitivity. It helps identify if you have hearing loss, how severe it is, and what type of loss you might have. The horizontal line on the audiogram represents different pitches or frequencies, measured in hertz. These range from low sounds like a drum beat to high sounds like a bird chirp. The vertical line shows how loud a sound needs to be for you to hear it, measured in decibels. The top of the graph indicates very soft sounds, while the bottom shows loud sounds. When you look at the points plotted on the graph, they show the quietest sounds you can detect at each pitch. The lower the point, the louder the sound needs to be for you to hear it, which means your hearing at that frequency is worse. By examining these points, audiologists can determine the degree of hearing loss. If your thresholds are between 0 and 25 decibels, your hearing is considered normal. If they are higher, it indicates some level of hearing loss. For example, mild loss is when thresholds are between 20 and 40 decibels, meaning you might have trouble hearing soft sounds or understanding speech in noisy places. Moderate loss is between 41 and 55 decibels, making it harder to hear quieter conversations. Moderate to severe loss ranges from 56 to 70 decibels, where normal speech may be difficult to understand unless you are close to the speaker. Severe loss is between 71 and 90 decibels, and hearing is limited to very loud sounds or sounds very close by. Profound loss is above 90 decibels, often meaning speech is inaudible without assistance. An audiogram can also help determine the type of hearing loss. It compares two types of testing: air conduction and bone conduction. Air conduction tests how well sound travels through the outer and middle ear, while bone conduction tests how well the inner ear and auditory nerve are working. If both thresholds are high but close together, it suggests sensorineural hearing loss, which involves the inner ear or nerve. If air conduction thresholds are high but bone conduction is normal, it indicates conductive hearing loss, meaning there is a problem in the outer or middle ear. When both are elevated but there is a gap between them, it is called mixed hearing loss, combining features of both types. Most audiograms focus on frequencies important for understanding speech, typically between 500 and 4,000 Hz. The audiologist may calculate a pure tone average, which averages the thresholds at 500, 1,000, and 2,000 Hz. This gives a quick overview of how well you can hear speech sounds, which is useful for planning treatment or interventions. Audiograms are usually done separately for each ear to identify differences. Sometimes, masking techniques are used during testing to make sure the results are accurate, especially if one ear hears better than the other. The results from the audiogram are combined with your medical history and symptoms to help your healthcare provider decide on the best course of action. In summary, an audiogram is a detailed map of your hearing abilities. It shows how well you hear at different pitches and loudness levels, reveals the degree and type of any hearing loss, and guides decisions about hearing aids or other treatments. Understanding your audiogram can help you take informed steps toward protecting and improving your hearing health. Remember, always consult a healthcare professional for personalized advice and interpretation of your hearing test results.